Introductory Psychology students, and thank you so much for joining me for this video. In this video, I am going to review Module 48, which discusses anxiety-related disorders. Okay, so in this video, I'm going to talk about generalized anxiety disorder, in which a person is unexplainably and continually tense and uneasy. Panic disorder, in which a person experiences sudden episodes of intense dread. Phobias, in which a person is intensely and irrationally afraid of a specific object, activity, or situation. Obsessive compulsive disorder, in which a person is troubled by repetitive thoughts and/or actions. I am not going to discuss post-traumatic stress disorder, in which a person has lingering memories, nightmares, and other symptoms after a traumatic, threatening, or uncontrollable event. If you would like to learn more about PTSD, though, I would encourage you to write your final paper on it, your extension paper, as it is included as one of the potential topics. Okay, so let's go ahead and get started with Generalized Anxiety Disorder, or GAD, as it is abbreviated. So generalized anxiety disorder, the specific symptoms or the characteristic symptoms of generalized anxiety disorder include persistent worrying, and specifically worrying without a definable cause. So having anxious feelings and thoughts about many different subjects, and sometimes what's called free-floating anxiety, right? So that free-floating anxiety is what I was talking about. So it's worrying, physical tension, muscle tension, extreme anxiety with no definable cause, okay? So again, free-floating means not being able to identify the source of anxiety. And generalized anxiety disorder tends to occur along with mild but persistent depression, right? So we often treat GAD, or generalized anxiety disorder, with antidepressants because the two disorders co-occur so frequently. And interestingly enough, there does seem to be a specific developmental progression with generalized anxiety disorder, in that it tends to present more often in women and more often in individuals under the age of 50, right? So there's no, at this point, there's no really satisfactory explanation as to why that might be. Some psychologists have speculated that perhaps with experience, right, that we acquire as a result of being older, maybe we come to observe that things don't usually turn out as badly as we thought, right? So the same sort of persistent anxiety we eventually learn is not justified, but that's just speculation. The relative prevalence or frequency of generalized anxiety disorder is actually quite small. So it only affects about 3% of the population. And again, it tends to happen most often in women. So we talked about the emotional cognitive symptoms, that feeling of free-floating anxiety and constant worrying. But there are also physical symptoms, and those physical symptoms are specifically caused by a constant state of arousal of that autonomic nervous system, right? So remember, our autonomic nervous system is designed to help us to detect threats, right? Threats to our physical survival, and to prepare our body to either fight, that threat or flee a dangerous situation. So essentially what happens in most anxiety disorders is we have activation of that autonomic nervous system, but no actual threat that's present. So we have a lot of the same hormones being released, and that causes this constant state of physical arousal that is characteristic of anxiety. So that might include things like sweating, trembling, fidgeting, just general physical agitation, maybe tapping your foot a lot or moving your hands, and also sleep disruption. So anxiety often co-occurs with things like insomnia or difficulty falling asleep, as well as difficulties with things like concentration. So let's look at the DSM-5 criteria for generalized anxiety disorder. So these are the symptoms that one has to have in order to qualify for a diagnosis of this disorder. So for example, excessive anxiety and worry occurring more days than not for at least 6 months. And it has to be about a number of events or activities. So not just one particular context, but it has to be, for example, anxiety at work or anxiety in an academic context. The person may also find it difficult to control their worry. And the anxiety and worry are associated with 3 or more of the following symptoms. So it might be general restlessness or feeling on edge, difficulty concentrating, irritability, muscle tension, sleep disturbance, something like that, right? So again, we're looking for a pattern of symptoms, not just worry. Okay? So worry by itself is not enough to qualify for a diagnosis. As we see with D here, the focus of the anxiety cannot be worry about having a panic attack. So we'll see that with panic disorder. It can't be a fear of being embarrassed, which we would see with social phobia. It can't be a fear of being contaminated with germs, as we would see with OCD. And it can't be related to being away from relatives, as we would see with separation anxiety. Gaining weight, as we would see with anorexia. And it can't be associated with illness, as we would see in hypochondriasis or trauma related to post-traumatic stress. Okay? So essentially, we're trying to exclude related anxiety disorders, right? And again, in F, or E rather, that's the most important symptom, or one of the most important symptoms is that, or one of the most important criteria is that these symptoms have to cause significant distress as well as dysfunction in relationships, one's vocation, or an academic context. Oh, and also these effects cannot be related to substance abuse. Okay, so next we have panic disorder. So panic disorder, like I said, includes the fight or flight system and easily triggering the autonomic nervous system, right? So in a panic attack, the mind sort of fills in the explanation for the autonomic arousal, right? So, for example, the symptoms that are characteristic of a panic attack include things like several minutes of intense dread or terror. It includes chest pains, choking, numbness, and other frightening physical sensations. And panic attack is the number one reason for people coming into the ER because it does mimic the symptoms of a heart attack. And panic disorder also often invokes a feeling of the need to escape. Okay? So again, with panic disorder, what's happening is we see an overactivation or inappropriate activation of that fight or flight response. So if you're feeling all of these symptoms, your mind kind of tries to fill in an explanation, right? So if I'm feeling terror and a physical response to a threat, there must be some danger here, right? So people sometimes attribute the panic to whatever situation was present when the attack occurred, right? And there's also a tendency to demonstrate extreme avoidance of possible panic triggers, right? So, for example, after repeatedly having panic attacks out in public, individuals might develop a condition called agoraphobia, where they develop an intense fear of going outside or leaving their home because they're afraid they might experience a panic attack and have no way to escape, right? Okay, so panic disorder specifically refers to repeated and unexpected panic attacks, as well as a persistent fear of again having a panic attack and a change in behavior to avoid panic attacks, right? So extreme social withdrawal or becoming a recluse, for example, because of fear of future panic attacks, would be one of the diagnostic criteria for panic disorder. Again, so let's look at this. So there can be panic disorder with or without agoraphobia. But first, let's look at the diagnostic criteria for a panic attack. So the DSM defines a panic attack as a discrete period of intense fear or discomfort in which 4 or more of the following symptoms developed abruptly and reached a peak within 10 minutes, right? So that can include sweating, trembling or shaking, heart palpitations, shortness of breath, feeling of choking, chest pain, feeling dizzy or lightheaded, fear of losing control or going crazy, fear of dying, numbing or tingling sensations, as well as hot and cold flashes. Right? So panic disorder simply refers to recurrent panic attacks, or at least one attack, or at least one of the attacks has been followed by 1 month or more of the following symptoms: persistent concern about having additional attacks, worry about the implications of the attack or its consequences, and trying to rule out alternative explanations. The panic attacks can't be due to physiological effects of a substance, such as an illicit drug or medication, or a general medical condition. So, for example, hyperthyroidism often creates heart palpitations and tingling sensations and a lot of the same symptoms of a panic attack. And also, the panic attack can't be caused or accounted for by another anxiety disorder, like social phobia or specific phobia or OCD, or separation anxiety or any of the other kinds of anxiety that I mentioned in the last slide. Okay? And again, agoraphobia is simply refusal to leave one's home because they're afraid of going out into public spaces and having another panic attack. Okay. So specific phobia is more than just a strong fear or dislike, but rather it is an uncontrollable, irrational, or intense desire to avoid some object or situation. So I'll give you an example, a personal example So my grandmother on my mom's side has a textbook specific phobia of snakes. And my mom can remember many times throughout her childhood because they lived on a farm where my grandmother would see a snake and either start running and keep running until someone caught up with her, or there was a time where she jumped up into the rafters to avoid the snake, and my mom's younger brother would have to get rid of it somehow with a broom or a shoe. And her phobia was such that not only would she avoid the actual object of the snake, right? So she would avoid an actual snake that was in front of her, but she also couldn't watch snakes on television or see a picture of a snake without immediately averting her eyes and showing a very obvious anxiety response. And this was such a characteristic fear of hers that when my grandfather passed away of mesothelioma several years later, one of the last things he said before he died was, "What are you going to do about the snakes?" Right? So who's going to take care of Grandma after I'm gone if there are snakes? And we all had to promise that we would keep her away from snakes because it was well known that she was extremely, extremely phobic of them. Right. Well, so like I said, even an image of the object can trigger an extreme anxiety response. Okay. So evolutionary psychologists have asked the question if anxiety is part of our biological repertoire, right? So perhaps panic, when functioning as fight, flight, or freeze, helped our ancestors stay safe when encountering danger, right? Or perhaps worrying helps us plan how to face future danger, right? So one of the things that seems to suggest that even specific phobias are evolutionary is that some of the things that are very common sources of specific phobias include things like snakes, heights, closed spaces, and darkness, right? Whereas similar but non-phobic objects include fish, low places, open spaces, and bright lights, right? So what does that mean? Well, it means that a lot of the objects that we commonly associate with phobias presented some kind of an evolutionary danger during our ancestral days, so to speak. And further evidence of this is that dangerous yet non-phobic objects include things like guns, electric wiring, and cars, right? We are likely to be cautious about these things but not phobic about them. And if we think of the relative danger of guns, right, compared to snakes or even heights or closed spaces, they're significantly more dangerous. However, we tend to have phobias to those specific objects. So there's obviously some kind of an ancestral influence, right? So evolutionary psychologists believe that our ancestors that were prone to fear the objects in the first list were less likely to die before reproducing, right? And there has not been enough time yet in terms of our evolutionary history for us to develop an innate fear of things on the third list. But presumably, with millions and millions and millions of years of evolution, we could potentially acquire a fear of those objects as well. Okay, obsessive compulsive disorder. When we talk about obsessions, we're referring to intense, unwanted worries, ideas, or images that repeatedly pop up in the mind. Okay? A compulsion is a repeatedly strong feeling of needing to carry out an action, even though it doesn't feel like it makes sense. Okay, so when is this considered a disorder, right? There has to be the presence of either distress or dysfunction. So distress or mental anguish, right, could include maybe feeling deeply frustrated at not being able to control the behaviors, whereas dysfunction might occur when the time and mental energy spent on these thoughts and behaviors interfere with everyday life, right? So, for example, one of my colleagues in graduate school who researched OCD as part of her PhD also suffered from OCD herself. And she shared that the moment when she finally sought treatment for her OCD was when she came home and had to engage in these compulsions, which in her case was repetitive hand washing and checking, so making sure all the doors were locked, etc. And she came home, and it was a long car ride that she had been on, and she had to use the restroom. But she couldn't allow herself to do that until she finished all of her rituals. And as a result of that, she had an accident. And so that was when she realized that these compulsions and racing thoughts and things were kind of taking control of her life in a profoundly negative way. And that prompted her to get treatment. So why do we consider OCD an anxiety disorder as opposed to a different type of disorder? Well, because the obsessions can be a distraction from underlying anxiety, okay? And compulsions worsen through a cycle of negative reinforcement related to anxiety. That's why we consider it an anxiety disorder, because the racing thoughts or obsessions arise as a result of anxiety, and the compulsions develop in an attempt to control anxiety, right? So the individual who has OCD resists carrying out a compulsion, feels anxious, and ultimately relieves the anxiety by carrying out the compulsion. Okay, so here are some of the most common OCD behaviors. So in this table I have the percentage of children and adolescents with OCD reporting these obsessions or compulsions. So by far the most common obsession or repetitive thought tends to be concern with dirt, germs, or toxins, or things becoming contaminated. There's also concern, just kind of a persistent feeling of doom, that something bad will happen, such as death or illness. And the least common manifestation of OCD is in things like symmetry, order, or exactness. So everything being symmetrical or exact. The most common compulsions tend to be things related to germs, so things like hand washing, bathing, toothbrushing, or grooming. Repeating rituals, so going in and out of a door or up down from a chair, or stepping on specific cracks in the sidewalk, as well as things like checking doors, checking locks, checking appliances or car brakes, things like that. Okay. So common patterns might be rechecking, right? So although you know that you've already made sure the door is locked, you might feel like you have to check it again and again, right? Okay, so lastly, here is the DSM criteria for obsessive compulsive disorder. So again, the presence of obsessions, which are recurrent or persistent thoughts, impulses, or images, as well as intrusive or inappropriate thoughts that cause anxiety or distress. Also, compulsions, which are defined as repetitive behaviors that one cannot stop. And again, if we look at B there, at some point during the course of the disorder, the person has recognized that the obsessions or compulsions are excessive and unreasonable. And again, these obsessions or compulsions are going to cause considerable distress. They're going to be time-consuming, or they're going to significantly interfere with a person's normal routine, their occupation or academic functioning, and their social activities or relationships. Okay, so this was just a brief overview of anxiety disorders, or Module 48. If you have any questions, please don't hesitate to reach out, and I look forward to seeing you in my next video.